Welcome to the DARE podcast, where it is all about helping people overcome anxiety and panic attacks. The DARE app has over 1 million downloads and is free to download at dareresponse.com. Now, without further ado, here is the DARE podcast.
Is somebody here? There she is. Hello, Michelle.
Hello, Aida.
Good to see. I always wait a few minutes because I'm afraid I will kick you out.
I wait. I'm like, I don't want to be first and wait for you. Wait for you until I think you're here.
Hello, Dr. Nishi.
Hi, good morning.
Hi.
Good morning. So glad you made it.
Yes, it's good to see you both.
You too. This is going to be a great call.
It will be. How are you?
I'm doing well. Yeah, thank you. How are you both doing today?
Good.
Good.
Thank you. Good. Awesome. So hi, Michelle, in a new office. Randall noticed you're in a new office, Michelle.
New office, new room in my house that I decided to claim as my own after this is my room now and nobody's coming back here and I'm turning the desk and this is my corner. And so we still have an old picture of Buffalo here, but soon to turn into DARE stuff.
Yeah. Awesome. So today we have Dr. Nishi here with us. Would you like to introduce yourself?
Sure. Yeah. So I'm Dr. Nishi Bhopal. I am a psychiatrist and a sleep specialist, and I also practice integrative holistic medicine. And I am based here in the San Francisco Bay Area and have a private practice called Pacific Integrative Psychiatry.
Isn't that great, you guys? Are you as excited as we are? Because I'm just going to
best of both worlds, right?
Yeah, I'm just going to call you Dr. Nishi. Is that okay?
Sure.
Dr. Nishi will help you with all questions regarding sleep and insomnia. And we know that a lot of you guys suffer from insomnia that comes with anxiety. So if it's okay with you, maybe Dr. Nishi, if you just would like to talk a little bit about sleep and anxiety and how it relates to one another, and then maybe we could pick some questions from the chat. Michelle, what do you think?
Yeah. And if there's not enough coming in, that's never going to happen. But we can even do our most, like, I'm sure off the top of your head, you can think of the same, like, how is medication and sleep used in conjunction? How do I get to sleep? What about weighted blankets? What about lavender? What about all the little things we use to sleep? And meditation and sleep. And I mean, we will have no lack of questions to ask.
Absolutely. Yeah, no, I mean, we could go on for hours. We could do a whole series just on sleep itself. It's such a big topic.
Absolutely.
So, yeah.
We should do it.
Yeah, there's so much to unpack there. And should I just jump in or?
Yes.
Yeah,
maybe,
definitely.
Yeah, maybe. Let me ask a question if that is fine. So do you see a lot of your patients that have anxiety who also experience insomnia?
Yes. Yeah. And so we see in the research that there's a bidirectional relationship between anxiety and insomnia. So what that means is that people who have anxiety have higher rates of insomnia. And then people who have insomnia who maybe didn't even have anxiety before are at a higher risk of developing anxiety later on from the insomnia. So the two things go hand in hand and they interact with each other. And it's thought that one of the reasons for this is because when you're not sleeping well, you actually get more activity in the amygdala, which is kind of the fear and anxiety center of the brain. So that becomes more hyperactive. And so that increases symptoms of anxiety. So part of dealing with insomnia, if you have anxiety, is really learning how to calm your nervous system during the day. And I know that's what DARE is all about kind of regulating your nervous system. And so oftentimes what happens when I see this with patients in my practice is they try to do that nervous system regulation right before they go to bed because they might have some sleep related anxiety, but that's not always going to work because if you're up here all day and then just right before you go to bed, you try to calm down, it's going to be really, really hard to do that. So good sleep actually starts during the day. And you really want to set yourself up during the day by calming your nervous system, developing good habits and routines, which we can talk about, increasing your sleep drive. We can talk about what that is and what that looks like, and then regulating your circadian rhythm. So if you can focus on these three pillars, your sleep drive, circadian rhythm, and regulating your nervous system during the day, that's going to set you up for better sleep at night.
But have you noticed, Dr. Nishi, like some people who experience insomnia, they're so hyper-focused on trying to sleep that they do all the right things during the day that they're told to do, but it turns into an exercise that is more a means to fight themselves into sleep, you know, and not as tools for something. Have you experienced that?
Absolutely, absolutely. And so Gillian Flynn, you know, the author of Gone Girl, she says, sleep is like a cat. It only comes to you when you ignore it. So sleep is like this, like the more focus you put on it, the more you try to do it, the more elusive it becomes. It just becomes harder to sleep. And so this is kind of the conundrum of sleep, is that, you know, I tell this to my patients, is that you actually want to stop putting your emphasis on trying to get good sleep, even if you're doing all the right things during the day, with the idea that it's going to help you sleep, that actually can make things worse. And so you want to shift your attention to just focusing on relaxation rather than focusing on trying to sleep, because trying to make yourself sleep is like trying to make yourself eat when you're not hungry. It's just, it doesn't work.
That's a great
See, guys, you hear that word trying? You hear we say that word all the time. I'm trying to do nothing. I'm trying to calm down, trying to sleep. It's just the word trying is the opposite of how sleep works. You don't try to sleep. We're doing so, like, take all of this advice to use for your overall well-being to set the scene for sleep, because sleep doesn't come from work. Sleep comes from when you let go, your body falls asleep. And so that's where all the DARE stuff comes in with this, of like, yes, this, like, Dr. Nishi, have you noticed there's a difference between people that maybe have problems sleeping and then treat sleep as a problem, right? Do you notice that as two different things?
Yes, that is such a great differentiation, because everybody has sleep issues once in a while, right? Like we all have nights where you don't sleep as well, maybe you don't get as much sleep, but people who are quote unquote good sleepers, I don't really like to use that term good sleepers, bad sleepers, because that can be problematic too. But people who don't struggle with sleep, don't think about it, right? Like you have a bad night's sleep and you're like, okay, you know, you just go on with your day, and then you kind of make up for it later, or you catch up later. But people who make sleep a problem are the ones who struggle, because that perpetuates that cycle of insomnia. And as you were saying, that you cannot try to sleep. Sleep is a passive process. We fall asleep. We kind of fall into it. Our nervous system kind of gradually goes into sleep. You can't force that.
But I would love to play devil's advocate here for a moment, Dr. Nishi, okay? But I have heard that a lack of sleep will be detrimental for my health.
It's going to increase my anxiety throughout the day. Better get to sleep.
Make it much harder for me to implement DARE. I am at increased risk for dementia. What is an all-time classic? Decreased immunity, immune function. What else? Depression. So what about that? So I need to sleep. I must sleep, because if I don't, then this will happen.
Everybody says it's super important. So, and I'm really trying.
Yes. And so this is another one I hear all the time from my patients. And this is where I think kind of like the world of sleep medicine has kind of done people a disservice by emphasizing so much on the negative aspects of sleep. Because when we talk about these things, we're looking at people who are getting consistently, you know, less than 6 hours, maybe 5.5 hours, consistently over years and years and years. And that's not true for most people. Even people who have chronic insomnia are typically getting more sleep than they may realize. And so again, we want to focus on unpacking that anxiety and untangling that anxiety about sleep, so that you're not worrying about it so much, and you're actually focusing on relaxing your nervous system and doing all these other, you know, healthy habits, circadian rhythm, eating well, and so forth, so that you can reduce your risk of those other things as well. Now, for people who are really struggling with that anxiety about sleep and they just can't get past it, this is where cognitive behavioral therapy for insomnia is really helpful. So that's called CBTI, or cognitive behavioral therapy for insomnia. And that's all about untangling the anxiety about sleep. It's about relaxation. It's more than just sleep hygiene, because everybody knows about sleep hygiene, but it goes much more beyond that. There's actually very specific protocols to actually increase somebody's sleep efficiency by reducing the amount of time they're staying in bed and then gradually increasing it. So that leads me to another tip, which is that when people don't sleep well, the tendency is that they spend more time in bed hoping they're going to get more sleep, right? So they're like, okay, let me just go to bed a little bit earlier, or I'll just try to stay in bed in the morning. Maybe I'll fall asleep and get a little bit more and it'll be good for me. But actually that is counterproductive, because the more you're awake in bed, you're actually training your brain to stay awake in bed. And so we want to break that association by spending less time in bed, which seems counterintuitive, right? Because am I not going to get less sleep? But spending less time in bed is actually going to increase your sleep efficiency, which is the marker of sleep quality, which is just as important as your sleep duration, which is just how much sleep you're getting.
So I advise my clients who suffer from insomnia to already prepare before they go to sleep something that they could occupy themselves with when they're awake. Knitting, preparing a snack, already having some tea ready, just to have the experience that being awake is something that is okay.
Yes. Right. I call it the fight of awakeness. It's like, I have a sleep problem, like you have an awake problem because you're awake at the wrong time. And now you're fighting being awake, trying to get back to sleep. And if you're already going to bed, braced as if like it's a threat, as if waking up is a threat, you're already going as if like, you know, the murderer is coming to your house at our favorite time between like 2 and 4 o'clock in the morning. Right. And it's, as you know, we get into a lighter stage of sleep, we wake like this. Wait, I was supposed to do something. Oh, I was supposed to fight myself to sleep. And now you're in a heightened state, right? Jolted awake to remind yourself to stay asleep. And it's so opposite of what needs to be done.
Yeah. Wow. That's going back. Sorry, Dr. Nishi, going back, because I think this is so important for people to hear. So you are saying that if I don't sleep well for a few weeks, let's say I only get 3 to 5 hours of sleep each night, I'm certain I'm not sleeping more. This is not, doesn't mean anything bad for my health. So I can put that fear at rest.
So if that's happening for a few weeks, it's not likely to cause any significant issues. Now, you may notice that during the day short term, you're a bit more irritable, it's a bit harder to concentrate, maybe you're a bit more snappy with your partner, you're making, mistakes at work, typos in your emails. Those types of short-term things do happen, even with one night of sleep loss. You may be at a higher risk of getting into a car accident as well from the sleep deprivation. So there are short-term risks that are very tangible that do happen, but those long-term risks of, dementia and cardiovascular disease and all of those things, those happen after years and years. So if you have been struggling, for people who have been struggling for years and years with sleep, then I highly recommend doing that cognitive behavioral therapy for insomnia, because that's really effective and even more effective than medication, which we can talk about as well.
Yes, please.
With less side effects.
Everybody loves to talk about medication. And now we have somebody who can.
Yeah, but I think this is really important because most people who are members of DARE, they struggle with insomnia that lasts for a few weeks, right? It's not the chronic anorganic insomnia usually. Of course, there are some cases, but I think the majority are those that struggle for a few weeks or months. And I think it's really, really important, you guys, that you're here. This is not doing anything, it's not detrimental to your health. You may be a little bit more irritable and snappy, as Dr. Nishi said, but it is fine. So you can put that worry at rest, which I think is really, really a big one. And from my personal experience, Dr. Nishi, I remember when I was going through insomnia, lying in bed thinking to myself, oh God, tomorrow is gonna be awful. And it was not awful. Like it was complete opposite. I had energy, everything was fine. Yes, I maybe didn't feel perfect, but I could actually perform well. So can you attest to the fact that those self-fulfilling prophecies and the projections, this is going to happen and that is going to happen, usually are not true?
Right. Especially for all the people who are now like, well, now I can't practice my driving because I didn't sleep. And Dr. Nishi said I'm going to crash my car. Throw that one in there.
Exactly. So, okay. So this is where our thoughts are so important. It's so mindful. It's so important to be mindful of how we're starting our day and the types of thoughts that we're kind of focusing our attention on. And so if you start your day by thinking like, oh my God, it's going to be horrible today. I'm so tired. How am I going to get through the day? I have this meeting, like, oh, I can't drive now. I'm too tired. Like if you start your day like this, that is going to set you up for not a very good day, right? Like that's going to inform how you go through your day. But if you can wake up and recognize like, yeah, I didn't sleep well last night, kind of tired, but I'm going to stay on track. I'm going to drink my water. That's what I always do first thing in the morning. It's 8 a.m. here. So my big glass of warm water, hydration, staying on your usual schedule and routine is really important. because that's going to increase your sleep drive so that you're more likely to get a better night's sleep that night. Now, if you're so tired that it's hard to drive or you're worried about that, then see if there's another arrangement you can make. Maybe take an Uber to work or take the bus or get a ride with a friend. Or if you're working from home like me, then that's kind of a moot point. But you can kind of plan accordingly, but it doesn't have to be you don't have to set yourself up for having a really bad day ahead, because that's going to affect your sleep at night, because it's going to put more pressure on you to get a better night's sleep, right? So we want to take away that pressure.
Because sleep is one thing, and then other people also use sleep because they're afraid. They're not even just worried about not sleeping. They're trying to sleep so that they're not tired, because tired means something during the day too. And then it becomes like, anybody in the chat also like resonate with all of this? Like, again, like now being tired means something about my activities during the day. Like, as if I feel tired, I will not perform well at work. Better get all the sleep. And so like sleep has all this negative connotation attached to it. And then being tired, and then spending all day preparing yourself for bed, but with okay, I hope I sleep tonight. Hope. And let's do all of these things so we can make sleep happen. And like, it's like the same thing when we talk about exposure therapy. It's action, right? You do all of these good things, so you're going to get a lot of good tips. But if your attitude and intent are not on the same page, you're going to, same thing. I did a post on trauma this morning. You're using things as a weapon to get rid of, rather a tool to teach you how to let go of. And like, would you agree? All of this is tools to teach you overall wellness routine and kind of how to leave your body alone, like set the scene for sleep so that you allow your body to fall asleep.
Yes, that's so true. And just touching on earlier, when we were talking about like, oh, you can do knitting or have a variety of things you can do in the evening. So I like to tell my patients to create like a relaxation menu, so that you've got maybe 5 or 6 items on your menu that you can focus on in the evening to help you unwind. And sort of just taking a step back here too. So we want to look at the nervous system, the autonomic nervous system. There's the 2 branches, the sympathetic and the parasympathetic, right? So the sympathetic is your fight, flight, and freeze response. And that's what we get into if we're feeling a little bit anxious or overwhelmed or worried. And then the parasympathetic is the rest and digest response. And that is what is active during sleep. So we need to go into the parasympathetic nervous system in order to fall asleep. But the more we try, the more we get into that sympathetic nervous system. And this is where the thoughts are really important. So if we're having the thought that, oh, I'm tired, how am I going to get through this day? How am I going to get through that meeting? Or how am I going to do this presentation? I had to wake up a little bit earlier than usual today. And I noticed I was having those thoughts like, oh my gosh, I'm so tired. How am I going to do this talk? But you can reframe those thoughts, right? Like, well, I've done it before. I can do it again. I can prepare myself. I've got some notes here. I can make sure I do some relaxation, make sure I drink my water and give myself some time to breathe in the morning. So you can actually anticipate by giving yourself space to do those practices that you know are going to help you.
Or you just wing it like we do.
Or you just kind of, oh shit, it's 5 minutes before the webinar. Let's go.
No, just joking.
I have your lip balm on, Aida. Aida bought me new makeup in Ireland. So if you can't tell us apart today, guys, that's probably why. So you have some good questions coming in here. Like, maybe like, can you give us, like, walk us through those pillars and maybe like a good sleep hygiene, like what bedtime looks like, what happens when you wake up during the night, what happens in the morning, that whole, because that's what it looks like a lot of these questions during the day. If I'm tired, should I nap? Should I not nap? So guys, but remember, there's 2 things. There's tips for sleep and then how we treat sleep. So remember, you're going to hear both of those. So remember, you're going to hear a lot of tips for how to create good sleep hygiene, but remember, they're not weapons. They're tools to help this overall process, not let's do everything Dr. Nishi says. And then tonight I'm going to go to bed and go, all right, sleep. I'm not going to work like that. So both two pieces here.
Yeah.
But Dr. Nishi, may I interrupt just for a brief second, Michelle? There are 2 questions that are always so pressing. So I thought if we can get those out of the way and then maybe do a big wrap up where you walk us through from the morning till the evening, how a perfect day would look like to set us up for good sleep. So we talked a little bit about what to do when we're worried about not being able to fall asleep. But a lot of people, they are able to fall asleep, or just before they fall asleep, they wake up by an adrenaline jolt. So what's the deal with that?
Yeah, so that's a super common one. So yeah, so a lot of people will fall asleep and then around midnight, 2 a.m., 3 a.m., they wake up and then they're awake and their mind is going, or they're just awake, their body's awake and they can't get back to sleep. Super, super common. So there's a few things here. One is circadian rhythm. Like, are you getting into bed too early? And I see this with some of my patients, is that they get into bed, 8 o'clock, 9 o'clock. And of course, it's going to be different for everyone based on your schedule. So there's no one right time to go to sleep and wake up. Everyone has a different schedule. But for some people, if they're going to bed too early, and then, they've slept for 3 or 4 hours, their sleep hunger goes down. So you sleep drive. So it's like you've had like a meal and then you wake up and then you're like, okay, your body's like, okay, I kind of had enough for now. And that can become a pattern if we start getting anxious about it. Right? So it's totally normal to actually wake up in the middle of the night. Everyone does. And on a sleep study, when you look at an EEG, someone's brainwave patterns, you see they do wake up throughout the night, but then they usually fall back asleep pretty quickly. They might not even be aware that they woke up. So this happens to everybody. It's totally normal. Sometimes people wake up and they're awake for 20 minutes. That's normal too. That happens to me too. And then you just go back to sleep. But when you start worrying about it, or you start focusing your attention on it, that's when it becomes a cycle. Right? So you want to start breaking that cycle. And how you do that is you can stay in bed and focus on relaxation, maybe listen to a DARE meditation, do some breathing, and just focus on relaxing. You can even enjoy that quiet time. I tell this to my patients too, like, oh, I'm awake, it's quiet, there's no, distractions right now. I can just relax and enjoy the comfort of my sheets and it's so cozy. You can do that. And then eventually the body will relax. Now, if this keeps on happening and you're not getting into bed too early and you're just waking up in this kind of wired state, I also wonder, and this is where the medical piece comes in, I also wonder if the person's experiencing low blood sugar. Did they eat their dinner too early? And then now is their blood sugar low? And what happens is you can get a surge of cortisol, which can feel like anxiety. It can make you more awake. You can feel like your heart's racing. You get that jolt. You might even feel a little bit jittery. So that's something for people to look at. When did they last eat before they went to bed?
You gave us free passage to have a midnight snack.
Yeah, so I don't recommend
Dr. Nishi said I was probably hungry. So
yeah, go to you get your kind of ice cream. No, you don't want to be doing that. But what you can do, so I don't recommend eating in the middle of the night because that actually tells your brain that now it's daytime and we eat during the day. So we don't want to do that. But what we do want to do is maybe about an hour before bed is have a little bit of a high protein, high fiber snack. So that could be some nuts. It could be my favorite is like roasted vegetables with hummus, something like that. You could do like a nut butter and a piece of fruit, like that type of stuff. But you can do that about an hour before you go to bed. And that will help prevent that drop in blood sugar and that cortisol surge. Other things, so I'm a physician, right? So I'm always looking for like, okay, is there a sleep disorder? So, restless leg syndrome, kicking during your sleep, that's often associated with low iron, and low iron is often associated with anxiety. So that's how these things are all connected. So I like to look under the hood, as I say, and kind of examine some of these things and do blood tests and whatnot. Also sleep apnea.
I was going to ask you, sleep apnea and IBS comes up a lot on the calls.
Sleep apnea is a big one. So sleep apnea is when the airway kind of collapses during sleep and then you're just not getting enough air in, and that causes disruptions during sleep and also not feeling rested, feeling tired the next day. Increased risk of anxiety can happen with sleep apnea, and increased risk of depression as well. And it can cause these awakenings during the night. So again, that's something that I would look for and test for in my patients. And so if people think they might have that, then they can talk to their doctor to see if testing would be helpful. So there's loads of different things. So going to bed too early, low blood sugar, restless legs, sleep apnea, and then of course, anxiety perpetuating those nighttime awakenings.
Oh, and I want to say, not IBS, but acid reflux. That comes up a lot, like a nighttime acid reflux. So can you tell us about that too?
Yeah, that's a big one too. So interestingly, acid reflux and sleep apnea are connected too. So sometimes acid reflux can be a symptom or a sign of sleep apnea. But okay, so I was saying don't eat too early, but acid reflux can happen if you eat too late. So you don't eat right before. So about an hour, a large meal 3 hours before bed is a good rule of thumb. And then a snack, like I was saying, about an hour before bed is a good rule. But don't eat right before you go into bed, because then you're going to have a higher risk of acid reflux. So just be really mindful of the timing of food intake. And then for people who struggle with the acid reflux, they can use a pillow to prop themselves up a little bit, so that is less likely to have those symptoms.
Yeah, and that's why we always say, go get checked first physically. If there's something physically happening, right? Even pregnancy will keep you awake, right? I had restless leg syndrome every time I was pregnant. Probably had low iron, but it kind of went away when I wasn't pregnant anymore. And it's kind of like, you know, something's happening with my body, so all the systems are connected. So it kind of goes, you know, without saying that, you know, sleep would be affected as well.
Yeah. And, you know, just to add to that, you know, I think it's really important for people to recognize that there are these other conditions that can contribute to insomnia and sleep problems, because I see a lot of my patients getting really frustrated because they'll tell me, I've tried all these things. I did the sleep hygiene, I did the circadian rhythm, you know, I've done all this stuff and nothing's working. And sometimes when we start investigating, we'll find out, oh, well, actually you have low iron, you have low blood sugar, you have sleep apnea, and it's validating for people, because it's not their fault, right? So that's another thing I want to emphasize to people, is that it's not your fault if you're not sleeping well. And if you've done all the right things, you can alleviate some of that frustration by talking to a professional who can help guide you through these other elements.
Right. And, you know, hormonal changes I wanted to add to perimenopause and menopause, that comes up a lot as well.
EMDD.
EMS,
yeah. That's a big one too. And so just even with the menstrual cycle changes, interestingly, so women tend to nap more and feel more tired during the luteal phase, so like the 2 weeks before your period. But then they have more insomnia during the follicular phase, which is the 2 weeks after. So what I tell my female patients is just notice that, just track it, and see if there is a pattern there. And then if there is, some simple things you can do are just like plan your schedule a little bit around it, like build in some time for naps, and we can talk about how to nap effectively and stuff, but work with your natural system, your rhythms. You don't want to be fighting your system all the time.
Cool. So the second pressing question I have is sleep paralysis. That is also such a big one. And would you also say that people who go through anxiety or just through a heightened state of nervous arousal experience more sleep paralysis? Or could you give us a little definition on sleep paralysis for all the people who do not know what it means?
Yeah, sleep paralysis is so fascinating. I actually did a YouTube video on sleep paralysis. So.
Oh, did you?
Yeah, so anyway,
go check it out.
Sleep paralysis is essentially what it sounds like. So you're lying in bed and you feel paralyzed. And it's really scary. I have experienced this a couple times before.
So scary. So scary. Because you're dreaming and it's related to like you have to do something and you can't move.
Yeah. It's terrifying.
Or somebody's standing next to you. Have you experienced that? It's always kind of like a black shadow, a person who's standing next to you. You don't know who that person is, and you can't move and you can't talk. It's awful. But I have a secret weapon. I found it out after like the 10th sleep paralysis, but more on that later.
I want to know what your secret weapon is, but sleep paralysis is exactly that. Like it's kind of this mixed state of consciousness. So you're sort of in REM sleep, but you're also partially awake. And normally during REM sleep, which is rapid eye movement sleep, our body is paralyzed. That's supposed to happen during REM sleep, so we don't act out our dreams and hurt ourselves or hurt our partners. But with sleep paralysis, we're getting this mixture of REM sleep and awake. So you're kind of partially awake, but you're paralyzed. That's why it's so scary, because you can't even talk, like you can't vocalize. And so when I had that one episode really vividly, I remember it so clearly. I was in my medical residency and I was post call. So I just worked like a 30-hour shift and then I was going to sleep. And that is one of the risk factors for sleep paralysis, sleep deprivation, shift work. And I was lying there. It usually happens when you lie on your back. So for people who experience this, try lying on your side when you're going to sleep. It's less likely to happen on your side. But I was lying on my back and I heard the door open and like two people coming in and walking up the stairs, like step, 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 and talking to each other. And I was so scared.
Freaking
Like,
worse, man. I know.
it's like a nightmare come to life. But this is why it's so distressing for people, because it feels so real. And people don't want to tell their doctors about it because they think they're going to be labeled as crazy, right?
Right. This means I'm going crazy.
Exactly.
Right? This must mean I'm losing it. Mm-hmm.
Yeah, exactly. Like they're going to think I'm having hallucinations and need to be hospitalized or something, but that's not the case. So it happens with sleep deprivation, shift work, also other sleep disruptors like alcohol can increase the risk. And if there are other sleep conditions like we talked about, like sleep apnea or restless leg or periodic limb movement, which is a variation of restless leg syndrome, those can also increase the risk of sleep paralysis.
Right. And as scary as that is, though, the way to go, if you're experiencing it when you go to bed the next time, again, if you're braced for, oh God, what if it happens again? Right. Because I remember so it was right after I had my third baby, I had also gotten a fever. I had gotten sick. And then I came home and every time I fell asleep, I was frozen solid. And I don't know if it was because, of all the things that just happened a few days before, but I was like, I could tell I was starting to get scared to go to sleep because I was scared of being scared while I was asleep. Finally, I'm like, I'm freaking tired. I have a 2-day-old baby. Whatever. I had to just, and it's that mind shift, right? Where it's like allowing the potential for that to happen without bracing yourself for it. Because if you're in more of a braced state, you're in more of a fight state. And that, would you say that that's very similar to like the hypnic jerks where your body's falling asleep, but your mind is still awake. And so you kind of notice, that's why it feels like you're falling after a pretty big stress period as well. Because this comes up so much. I'm like, hypnic jerks, guys, hypnic jerks. They're on all the calls, but because it feels so scary. And if you've never really remembered experiencing them, they feel like, oh, this must be anxiety, when it's common, right? Usually after like a long stressful or high stress sort of day or period of time.
Yep, exactly. Very, very, very common. And, I've experienced those too. I think that's why I'm so interested in sleep, because I've had all these experiences. I've struggled with kind of sleep and sleepiness since I was a kid too. So, but yeah, no, I've had these. They're very common. A lot of my patients have these hypnic jerks. And so the thing to remember is that these are actually benign conditions.
Mm-hmm.
Sleep paralysis, as terrifying as it is, it's benign. It's not going to cause you any damage. It's not a sign that there's something horribly wrong. It's just part of our interesting physiology. Sleep physiology is fascinating. It's one of those things that happens. So are hypnic jerks, and they happen during times of stress. So again, this is why it's really important to, when you can, stay on a regular sleep schedule, work on your stress management during the day, and then work on optimizing those underlying factors that we talked about, your iron levels, your vitamin levels, vitamin D, vitamin B12, eating healthy fats, getting good nutrition. We can look at that too. But, all of these things are helpful. But yeah, like you said, you want to just separate the anxiety from the experience, because these experiences are normal. They happen to most people.
That's a good line. That's a great line. Separate anxiety from the experience, because the experience is normal. Everybody, when I have them, I crack up laughing. It's a weird automatic reaction, but like I jump and then I just start giggling in bed. But other people, it scares the shit out of them, right? But other things scare me too. And so it's like, the sleep paralysis was scary, but hypnic jerks weirdly make me laugh. So it's a matter of like, what happened and what's my story about what happened, right? What are the facts and what's the story about the facts? And so the story is kind of what decides this was bad. Oh, now I have sleep paralysis. And now Dr. Nishi said, now I have hypnic jerks. And now you don't have anything. That's just the name of that, what that experience is called. We just give it a name. So you're like, oh, that's what that is. I thought I was going crazy. And can I just ask one more question before we go on to the wellness day and night? Throwing that in there, auditory and visual hallucinations when you're falling asleep comes up a lot for all the people that are desperately worried about being crazy, because I heard a loud pop, or I heard a voice or a noise, or I saw a bright light, or I saw something.
Wood cracking, right? That is also common. I hear like the sound of wood cracking.
A crack, a pop, a yell, a voice, something, a light, whether it's with your ears or with your eyes. So I know everybody's tired of hearing it from us. So now we got the doctor. I'd love for you to, if you could talk about that for a minute.
Definitely. Yeah. So that's actually really similar to sleep paralysis. So where you get that REM intrusion, right? So you're kind of in this mixed state of kind of being awake in light stages of sleep, but then there's some REM sleep. And so that's where these are dreamlike experiences. That's why, the REM sleep kind of comes into play. So yeah, so again, it's totally normal. If you're hearing something, if you're seeing something, you might see a shadow or bright light, or you might hear somebody talking or feel like somebody's there. Very, very similar to the sleep paralysis. So again, it's normal, benign, nothing to be, super concerned about, unless you think you might have some sleep apnea or you might have some other condition. Then you can do a sleep study if you think there's something else going on to get that evaluated, especially if it's happening on a regular basis. But if it's happening once in a while, it's generally not something to be terribly concerned about. But sleep deprivation, shift work, circadian rhythm issues, alcohol, all of those can exacerbate these experiences too.
Now, notice she didn't say, oh, the only time to be concerned is not if you're about to become psychotic, because that's what everybody's worried about when they hear those things. They're kind of apples and oranges there. It's more of like, oh, you're kind of aware of being asleep. And so you're entered into this weird state where like you notice your body sleeping, right? This heightened awareness. And so that's the problem, not this is the signs of becoming crazy. And so I love that this was addressed on this call, because this comes up a lot. So we will cut this and probably put this up on YouTube or all the social media somewhere.
Yeah, Dr. Nishi, I tell all my clients who are afraid of going crazy and developing a psychotic illness, I always tell them, look, people with psychotic illnesses, like people who are anxious, they're so fixated on positive symptoms, the hallucinations and grandiose ideas, but those are not always evident, right? It's much more the negative symptoms. And this is not what you're experiencing, right? But people who are anxious are always fixated on the things they've seen in TV. An idea of a person, how does a person act who's going crazy? And where do we get these ideas from? Usually from TV, which are always, exacerbated, right? So would you say yes to that?
Yeah, that's exactly right. And what we see on TV or in the movies, it's dramatized, right? That's not how psychosis generally shows up in real life. And as you said, there are usually more negative symptoms with people who have psychosis, and those are the really problematic ones. That's where people have no motivation. It can look like depression. And generally people who have psychosis, this is not true for everybody, but generally they don't think about having psychosis.
Yes, they're not the ones coming for help, right? Other people, right? They're not. It's the awareness that's missing when it comes to psychosis.
Exactly. So when a patient comes to me with anxiety and they're worried about developing psychosis, that's usually a sign that, okay, you're probably not at risk of psychosis. I think we
did not prep her to say this, guys. We did not prep her to say this. We didn't even talk ahead of time. She's saying this on her own free will.
Cool. So before I forget, Dr. Nishi, so my secret weapon for sleep paralysis is coughing, reminding myself to cough. That works so beautifully because I had a few of these. And I remember I was going through, it was a positively stressful phase, but it was still a lot going on, even though there were cool things. And I used to take a nap, and I always got this sleep paralysis when I took my nap in the afternoon. And I was like, oh, this is ruining my day. I loved my naps. But every day I was lying down for a nap, I would get these sleep paralysis. And then I said, I need to find something that reminds me that this is not real so I can wake up. And I said, oh, I need to cough. So I tried that and it works miraculously. Awesome. You should try that out.
I love that.
Yeah. Cool. All right. So do you have any other question, Michelle, before we start into our big wrap up?
Are you going to work circadian rhythm into your wrap up? Because otherwise I'd love to hear like more of that in detail, because I think that would help a lot of people.
Or medication.
And medication. And we have so much to talk to you about. How many hours do you have? So if you want to work it all in, right? Like if we had a 20-minute, like Dr. Nishi crash course on the do's and don'ts of sleep.
She hasn't slept well, okay? Take it easy.
Because I've been up all night worried about this webinar.
Yeah, I gotta go take a nap now. Yeah, no, sure. I can kind of weave that all in.
Okay.
So circadian rhythm. So the circadian rhythm is our body clock. right? And I think the circadian rhythm is so fascinating because every living creature on the planet has a circadian rhythm. Even plants, they have their own rhythms and their own clocks. So as humans, we have a body clock that is slightly longer than 24 hours. And this is why it's really important that we stay on a schedule every day. Otherwise, the circadian rhythm can start to, migrate a little bit, and it can cause more sleep issues. So we want to keep our circadian rhythm in check. And there's three things that really help to keep the circadian rhythm in check. So one is light. That's the most powerful. We call it like a timekeeper. And then the second timekeeper or time giver is food, so the timing of our meals. And then the third is activity and exercise. So you want to be pretty consistent with the timing of light exposure during the day. So what I recommend is first thing in the morning. I did this morning because, like I said, I had to get up a little bit earlier and it's a bit dark in the morning, is get bright light. So if you can go outside for 10 minutes, that's ideal. But if you can't do that for whatever reason, then turn on the lights inside your home and get bright light. And that's going to signal to your brain that it's time to wake up. It's going to suppress your brain's production of melatonin, which is the sleep hormone, body clock regulator. So get that bright light. Stay in bright light during the day as well. This is really important, especially for people working from home. I have some patients who work from home and their offices are kind of dark. They might not even have a window. They're working in their basement.
Right.
So you can get like a light therapy device that we use for seasonal depression. You can use one of those. There's certain ways to use it, so we won't go into details about all of that, but you can use your light therapy device for your daytime bright light, or just be really mindful about going outside and getting some natural daylight during the day. That's really, really important to help you stay awake and alert. So that's the circadian piece. And then the third piece of that is to dim your light exposure in the evening. Okay, so here's something a little bit controversial. So everybody knows about blue light, right? Everyone's heard this, like, oh, no blue light in the evening, turn off your screens in the evening. But actually, the data is not totally conclusive on this. So what I tell my patients who have, especially for people who have anxiety, is don't be super anxious about staying off your devices in the evening, because then people will be like, well, what am I supposed to do if I can't watch TV, or I want to watch a show on my iPad, but I know I'm not supposed to watch TV before I go to bed. Then what? So actually, it's not that bad. Just turn the brightness to the lowest setting. And if it helps you calm your mind to watch reruns of Schitt's Creek, which is what I like to watch if I'm going to unwind, or if there's a movie you like to watch, something you haven't, something you've seen before, right, so that you're not trying to pay attention.
Doesn't require a lot of brain power, right?
Doesn't require brain power, like something you've seen before that's kind of light and fun that helps you relax in the evening. If that helps you fall asleep, then that's okay. So don't be super anxious about staying off your screens, because the data is not totally supportive of that, but just keep the brightness to a minimum. So that's the circadian rhythm.
What about exercise, Dr. Nishi?
Oh yes, okay, exercise and meal times. So I'll do the mealtime one, which is what I like to do is have an anchor of your main meal in the middle of the day if you can. I know it's not feasible for everybody, but if you can have your larger meal around lunchtime, so between like 11 and 1 p.m. in that time frame, that's actually better for your metabolism. And it's not going to cause as much sleep disruption. And then you can have a lighter dinner and then that snack an hour before bed. That's a really good thing to do. If you can't do that, then just be consistent about the timing that you eat, because the timing that you eat tells your body clock when we're supposed to be awake and when we're supposed to be asleep. So be regular with that. With exercise. So again, there's some really interesting data on this showing that vigorous exercise in the evening may not be as bad as we used to think. Because the general advice before was like, don't exercise before you go to bed. But me, I'm not a morning exerciser. Like, that's just not going to happen. Like, I'm going to exercise after work. I'm just not going to get up early and do it. So for people who are in that camp, if you're not going to get up early and exercise, it's okay to do it in the evening. But stop at least 1 hour before you go to bed. So no vigorous exercise within that hour before you go to bed. But until an hour, it's actually not going to cause too much disruption. Having said all this, these are not rules that are set in stone. So pay attention to your own body. Notice how these things affect you. Notice your own system, right? You are your best guide. We can give you all these tips, but it's going to be different for everybody. So just really be mindful of your own system and how these things affect you.
Yeah.
You would say keeping that routine, like once you have established a routine, to try and stick with that. Is that helpful for your body to remember when to be awake and when there's sleep time? Okay.
Yes.
It's almost
And-
like when you have babies, right? Like it's like when you start the nighttime routine, so they become accustomed to what's going to come next, right? After dinner, then we take a bath, and then we read a book, and then we sing a song, and then we go to bed. So you kind of get used to what's coming next.
Yes, that's exactly right. And you know how, so kids have their bedtime routine. They, you put on your PJs, brush your teeth, and do all that. We should do that too as adults.
Right. Right.
We can have our wind down routine as well.
We really have gone total opposite. Like the circadian rhythm, it's almost like going back to doing what human beings were designed to do before we now like have technology, and we like screwed it all up. Now we're like dark in the day, bright at night, right? We're doing almost the opposite of what our bodies were designed to do. And it's like back in the day, back in the day, you woke up when the sun came up, right? And when the sun went down, you went to sleep. But we just don't do that anymore. We kind of like fight the universe. And we're like, why can't I sleep?
That's so true. Because I mean, a lot of this is just kind of getting back to basics. It's not rocket science, right?
Yeah,
Like
yeah.
Just working with our own bodies and our own physiology. And there's even some tribes in Africa where they don't even have a word for insomnia. Like that concept just doesn't even exist because they're so connected with the earth and with their natural rhythms. So anyways, but yeah, that's the circadian rhythm. So I do highly recommend having that wind down routine in the evening. I'm a big fan of PJs, like pajamas. Like not a lot of people, some people just wear like t-shirt or whatever, but I like the idea of having clothes that you only wear for sleep, because it's like a cue for your brain. It's just like that really simple signal that, oh, okay, it's time to unwind, and then have that relaxation menu of items you can go to.
Right.
Yeah.
So we gotta get some Dare PJs then. Dare PJs.
Yes. So you put on your Dare PJs and you listen to the Dare wind down.
Wind down. So put a bit of Barry sleep mask on your face.
That is awesome. I like the idea of having a menu, Dr. Nishi. I've never thought about it this way. Like, oh, what could I pick today? What do I feel like doing today? That sounds so inviting rather than something I need to do. Right?
Exactly. It's like, so then it becomes more of a choice.
Yeah.
Like, oh, I get to do this instead of I have to do this.
Yes,
absolutely. Makes all the difference, right? Just thinking this way, all the difference. Cool. So can we touch on, sorry, I'm interrupting you again, but can we touch on, since we're talking about a routine, a lot of people, they take a hot bath, and some people think hot bath is not a good idea. You should take a cold shower and not a hot bath. So what do you think is best?
Yeah. So cold shower is good for the morning. To help you feel awake and alert. Again, I'm not going to do that. So like, it's not, so it's your body and
but you all should probably.
Yeah, you guys should do a cold shower. I'm not going to partake, but you should do it. But for people who do, I have patients who love doing a cold shower.
Oh yeah, it's a big thing here at Dare.
Yeah, it's a big thing. So if it works for you, then that's great. Pay attention to your body again, see how you feel, see if it helps you. Don't do things just to do them.
Yes, yeah.
Should, but really notice how these practices affect your system, your unique system. So if it works for you, then that's great. Then the best time to do that is in the morning. Now for the warm shower, warm bath, the best time to do that is in the evening. Or you can have your shower in the morning too. Again, these are not, thou shalt not take a bath at night or whatever.
Yeah,
but
no copious notes here, guys, right? Not like scratch out morning. No, it's in the evening, right?
These are sort of general principles. And the reason that a warm bath or a warm shower is good to do at night is because it helps to warm up your body, but cools your core body temperature. So when your extremities, your hands and your feet are warm, the blood is flowing to your extremities, and your core body temperature in the middle of your body starts to cool down. And a core body temperature is necessary for sleep onset. So that's why you might find, I don't know if anyone else experiences this, but I definitely do, is that if my feet are cold, I find it really hard to fall asleep.
I sleep with socks on because I'm so cold all the time.
So if you don't have time for your bath at night or whatnot, another trick is to use like those heated beanbag things. You can put those on your feet and on your hands. I like to use a heated blanket, and I put that on my feet. And
I like to use my dog.
Use your dog. Yeah.
Just covers herself in huskies.
Yeah, just pile yourself with dogs and animals and blankets. Warm up your extremities. That's going to help cool your core body temperature and make it easier for you to fall asleep.
Is that also the reason why everybody promotes like having cool room temperature? Is that to cool your core temperature down? It's 1%, right? It needs to drop 1% so you can fall asleep?
About that, yes.
So cold room, but with socks and mittens, right?
Cool. Awesome.
I can say something quickly about naps.
Oh yeah, naps.
Oh, thank you.
Yes,
So
that comes up a lot. Should I nap? Should I not nap?
Yeah.
Because I forgot to mention that with the circadian rhythms. So what happens is around 2 or 3 p.m. or between 1 and 3 p.m. we get a natural dip in our circadian rhythm. So this is where you would see in other cultures they might do a siesta, or everyone just kind of shuts down, goes home, and then they go back to work after. So that's because of that natural dip in our circadian rhythm. So for people who get tired in the afternoon, you can actually leverage that and allow yourself to take a bit of a power nap, which is generally 12 to 15 to 20 minutes, somewhere in that range. You might not fall asleep during that time, because a lot of people will tell me like, well, I try to nap, but I don't fall asleep. But you can still take a rest at that time if your schedule allows. And you can turn off the lights, put on your blanket, set your timer for 15 minutes, and just close your eyes and just breathe and allow yourself to rest. And that can be really rejuvenating. And large companies like Google, Huffington Post, NASA, Ben & Jerry's, they all have nap rooms in their corporate offices because they know that it actually improves their employee productivity when their employees take a nap. So the caveat here though is well, a couple of them. Don't take a nap for longer than 30 minutes, because then you get into deeper stages of sleep and it can take away from your nighttime sleep. It's like having a large snack before you go to bed, or before you eat dinner rather. You're not going to be hungry for dinner. So avoid long naps, because it's going to take away from your nighttime sleep. It's also going to make you potentially more groggy when you wake up, because you're going to get into those deeper stages. You might feel more tired. So less than 30 minutes is ideal. And then don't take naps if you struggle with chronic insomnia. That's just not a good idea. But if you don't have insomnia, then I'm a big fan of the power nap.
So you're saying, listen up everybody, if you're suffering from insomnia, no naps, no matter how tired you are, because it takes away from your sleep hunger. Is that correct?
Correct.
Okay.
Yes.
Push through. Okay, good.
Now I also have a lot of
right? She should write a few daily dares and all the things that she said.
She should write a lot of daily dares. A few means 47. So I want to ask you, I have a bunch of people too who instead of going to bed too early, they almost fight going to sleep, because sleep is a threat. Sleep is dangerous. Sleep is when I'm out of control, and sleep is when everything gets all screwed up. And so it's like, I have a lot of people, and anybody on chat who wants to pop on who might be like this too. I wait till as long as possible until my body's completely exhausted, and then I collapse, and then they get shitty sleep. And then they wake up kind of early, because it's just this cycle of exhaustion where it's like, I prolong sleep as long as possible because it creates more anxiety with the whole trying and waiting. And oftentimes it's hooked into thoughts and worrying. And now I'm so tuned into my body that we like try and fight it off for as long as possible until we kind of just give up and crash. That's typically what I see more often than people who go to bed early. It's usually like waiting as long as possible.
Yeah, no, and that's such a tough cycle to be in, and it's very stressful for people. So again, I like to kind of go back to basics and try to look under the hood to see, okay, well, what is going on here? Is there trauma that needs to be addressed? Was it unsafe for them to sleep when they were a child? And do we need to work on, do some trauma work around that? Because sleep is very vulnerable, right? Like you're asleep in your bed and you don't know what's happening around you. And that can be very scary for people. So that's one thing to look at. Another is there some underlying sleep disorder that we need to address, like sleep apnea or the leg movements and so forth? Are there nightmares? And so I see this a lot with my patients too. And there are specific techniques you can use if you do experience recurring nightmares. And I think I saw someone in the chat ask
Yeah.
about nightmares.
So that too.
Comes up all the time. Great, you're addressing it.
At least once a webinar. It's what about nightmares? How's anxiety related to nightmares? What do you do when you wake up after a nightmare and you're really scared?
Yes. Yeah. So nightmares are a big one. We could probably do one whole webinar just on those, but I'll just say quickly. So there's a therapy technique called imagery rehearsal therapy. And essentially what it is you're re-scripting the nightmare to not be scary anymore and to even be happy and very positive. And so I work on this with my patients, where if they have a recurring theme with a nightmare, we actually rewrite it and then they rehearse it before they go to bed. It's almost like reading yourself a bedtime story. And then you're training your brain, you're planting these sort of seeds of precognition so that you're more likely to have better dreams. But yeah, and then, making your bedroom a really safe and inviting place. We didn't really talk about that. We talked about the cooler bedroom, but really like creating your bedroom, making it into a place that you want to be, that you find safe and relaxing, that's well ventilated. That's a big one. I had a patient who was sleeping in a windowless, unventilated room and she couldn't breathe, like no wonder.
Yeah.
So, so looking at your bedroom, keeping it clean, dust free, using sheets that you find luxurious and comforting, and just making it a really lovely, safe space is important so that you're breaking that association of it being a place where you don't want to be.
Right. And when you wake up in the morning, to get up in the morning, if your brain is up, then you get up, because other people are, a lot of people are trying to stay asleep, but trying to get more rest, or if I'll stay till 8 and but not with oh, I get to stay in bed till 8. Oh, I woke up early, but I get to stay and relax. Like what I typically say is go for it if that's your mindset. Oh, I woke up at 6, but now I get to sit and chill out and just relax for the next hour. I say great. But if it's, oh shit, if I went to sleep at this time, then I can sleep this many hours. And if I sleep this many hours, that's not good enough. So let me try. And then it becomes almost like a battle. And so, right, when you wake up, it's time to get up.
Yes. Yep. So you don't want your bed to be a battlefield, right? So yeah. So if you're struggling with that, then definitely get out of bed. And here's tying back to the circadian rhythm piece, is get out of bed at the same time every day. And that's really important to anchor your circadian rhythm, especially for people who are a little bit more in the delayed body clock, like me, where like you want to sleep in on the weekend, get up earlier, get up earlier during the week. That actually creates more sleep disruption. So like really anchor yourself with that consistent wake up time.
So what would be more important? Because I have a few people who their sleep is so off. They're going to bed as like almost the sun's coming up and they're sleeping late. They wake up, it's almost sunset already. And so with the best, like what would you focus on first there? Would you focus on like the hours of sleep, or would you focus on like, this is the time I go to bed and this is the time I wake up? And then like, or would you move it back certain like 15 minutes at a time? Like, because I have some people, they're so off that they don't know where to get going.
Yeah. So the first thing I recommend to people is get a really good sense of what your sleep pattern looks like just track it. So you can see how consistent it is. So you can track it with a sleep diary. So the AASM, American Academy of Sleep Medicine, they have a free PDF sleep diary you can download. So start with that. I use a sleep tracker, the Oura Ring. We can do a whole series on that too, and how to use these. But get a good sense of what your sleep pattern looks like. And then once you have that, what I have found generally for people who are kind of nocturnal, they're sleeping during the day, usually they're getting enough hours of sleep, generally. It's just that their pattern is totally off.
Right.
So what we start with is by shifting back their wake up time. It's hard to make yourself fall asleep, but it's easier to make yourself get up, right? So we focus on the wake up time, and then we start to gradually shift that back by about 15 to 20 minutes every few days, or even once a week, depending on how stubborn their body clock is, and then getting really bright light at that wake up time to signal to their brain that it's time to wake up and suppress melatonin. On the other end, sometimes we use a very low dose of melatonin to pull their sleep earlier. But this has to be done very strategically, because if you don't do it the right way with supervision, it can throw things way off even more.
Yeah. And can we talk about medication before? I know you probably have to go, but like everybody, if the doctor's on the call, they want to talk about medication or supplements or melatonin, what it's used for, what to not use it for, like how to get to sleep, or is it an aid, or is it, there's going to be a everybody wants to talk about medication. So this is a great time to ask that question.
Definitely. So, okay, so medication I think of in sort of two categories. One is the prescription medication, and then the other type are the over-the-counter medications. So the prescription ones would be things like Ambien, Xanax, Klonopin, or if people are outside of the US, those are US names. So like Zolpidem, Clonazepam, so the benzodiazepines and the non-benzodiazepine hypnotics. So those are that class of medication. Then the over-the-counter ones would be your Benadryl or diphenhydramine based medications. So these are like your Tylenol PM, your Advil PM, that type of thing. Now, these sleeping pills, sleeping medications were never designed for long-term use. They've only been designed for 2 weeks of use at a time. So they're very helpful for short-term issues with insomnia. And I do prescribe them to my patients for short-term use. So if someone, they're going through a stressor, they're going through a divorce, or they just lost their job and they need some support with sleep, that's where these medications can be helpful. But for people experiencing long-term issues with sleep, they can start to do more harm than good, because with prolonged use, like months, they can start to cause tolerance, where you just get used to the dose and you need to get chase higher doses to get the same effect. You can get rebound insomnia. So when you stop the medication, you can't sleep without it. So now it's causing the issue you were trying to treat, right? So that's why I don't advise using these medications long-term. Now, having said that, for people who have been on these medications long-term, I have patients who come to me and they've been on Zolpidem or Ambien for 10 years. Then you need to taper off very carefully and very slowly. And so I work with people on that, of just doing a very, very slow taper while we work on all the other stuff we just talked about. And people have great success. They feel so much better when they get off these medications, and they sleep better.
You have a different kind of sleep, right? It's a different quality of sleep.
Yes. Yeah. It's not the natural sleep you would get without medication. And
I've heard that they take away like your deep sleep phases. Is that true?
They can affect, they can affect your sleep architecture. So you're just not getting the same level of restorative sleep. They also can cause issues during the day. Like people can feel more tired. They can feel a little bit hungover, a little bit groggy, have trouble focusing. They might not even notice that it's from the medication. They might not realize it's from the medication. And I've also seen patients who've been taking things like clonazepam or lorazepam, the benzodiazepines, for years, and we taper off, they feel less anxious because you can get this kind of like interdose anxiety in between. When it wears off a little bit during the day, you get this like assertive anxiety. So these medications are not good for long term. Now, supplements. So you'll see at the grocery store, the drugstore, there's all these different sleep supplements with different combinations of things, like lavender, lemon balm, chamomile, hops, theanine, magnesium, melatonin. So I always recommend, like, they're not terrible. They actually have some data behind them. These things can be helpful, so especially lavender has a lot of data. But I always recommend talking to a healthcare practitioner for guidance, because just because something is natural, it doesn't mean it's safe.
Right.
So even lavender seems like it's a flower, right? Like how unsafe can it be? But it actually can have estrogenic effects. So for people who have a history of breast cancer or for children, it can start to cause hormonal issues. So it's a good idea to talk to somebody who understands these things to give you some guidance.
Especially somebody like you. They should call you, because you're versed in both areas. Because again, I have a lot of people who have had a lot of negative experience with doctors, and because they're only like, well, oh, you can't sleep, here's a pill for this. And oh, this natural supplement, no, that's nonsense. And so like, you're like the perfection of two worlds coming together, because it's like, you go into both areas like that. And so I think I see in the comments, I need a doctor like you. So we'll put all of her contact information up.
Definitely.
After this.
She has a really cool YouTube channel, really cool Instagram. So check that out. It's oh my God.
What is it?
Intrabalance.
Intrabalance.
Yeah.
Like, I'm gonna memorize it so I don't have to look at it. I couldn't remember.
Yeah, Intrabalance. And you offer online consultations, Dr. Nishi, right?
I do see patients one-on-one in California only, just because that's where I'm located. So that's my private practice. Oh yeah, I'm just looking at I'm getting distracted by the comments here about the lavender.
Intrabalance. I'm going to Intrabalance.
Intrabalance. But my private practice is called Pacific Integrative Psychiatry. And yeah, I see patients across the state of California, and I help people with sleep and anxiety. I also have a nutritionist in my practice. So she helps people with GERD, with the acid reflux and with IBS and the nutritional aspects of mental health.
But do you do also coaching consultations for everybody outside of California?
Right
no,
now,
if somebody just wants to be educated, about sleep and supplements and circadian word.
Yeah, absolutely. So right now I don't do one-on-one consultations, but I do have a sleep course, like an online course where I touch on a lot of these things. And I also have this is brand new. So 2 of my colleagues, so there's 3 of us, we're all sleep specialists. We just started a Facebook group. It's called Sleep Divas, and it's for women who want to improve their sleep. So that's on Facebook. We just opened it this week. So if any women are interested, it's called Sleep Divas.
Well, you got a couple more divas joining, I'm sure. And now also somebody who's apparently moving to California so they can talk to you, Brenda.
Awesome. And we totally forgot to mention, you guys, Dr. Nishi, because somebody's asking, Dr. Nishi, are you familiar with their practices? Dr. Nishi is on our advisory board, you guys. So all the content that you see that is written by Barry, Michelle, and me is reviewed by Dr. Nishi. So she says, yeah, good to go, good to go, good to go. So she is familiar with DARE, definitely.
Who loves this? Who wants Dr. Nishi back all the time? All the time.
I know it's so hard with your schedule, but we're so grateful that you made it. Thank you so much. And I hope that we can repeat this. That will be great. And maybe we can record another one and put it up on YouTube. That would be good, right?
I'm sorry I fell asleep during this. What did I miss? Ha ha, Randall. See, it worked. It worked.
Yeah, we did our job.
All done. You guys can all quit there now.
Oh, wonderful. Thank you, Dr. Nishi. Thank you, Michelle.
So much.
Thanks so much for joining us. Guys, thank you for joining us in the chat. This will be up on the app probably by tonight or tomorrow. Yeah, you can watch it for the rest until the next webinar but not until next month. So I'm not exactly sure the date, but it'll be on there as well. So sign up ahead of time, send in the questions. And if we have time in between the webinars, we'll pop on the Instagram or Facebook and we'll answer some questions in between. And yes, we'll save them. I mean, we have plenty. If we don't make them here, we were talking about just using these to jump off on videos for Instagram or TikTok or YouTube. So these, instead of thinking of content, I mean, y'all are sending us all the content, all the questions to create the content. So yeah, we'll run right through these lists.
Awesome. Have a good day. Take care.
Bye, everybody. Have a great day. Thanks.
Thank you for listening to the DARE podcast. The DARE app has over 1 million downloads and is helping people all around the world to overcome anxiety and panic attacks. You can download the app for free at dareresponse.com.